The CDC is now advising vaccinated people in areas with high transmission to wear masks in indoor public spaces. The agency says the reversal is due to new data showing the Delta variant behaves unlike any other we've seen. Eva Pilgrim has the latest.
Overnight, Pfizer CEO Albert Bourla making the case for booster shots, saying some studies suggest the Delta variant challenges the vaccine's protection after 6 months. Talking to former White House advisor Andy Slavitt in a podcast.
We can see that there is a drop in the protection of infections, and there is a drop in the protection against hospitalizations, but only for people, or mainly for people, that they are 6 months, that they did 6 months ago their second dose.
The variant now responsible for an estimated 8 in 10 cases as we learn who is in those hard-hit hospitals. ABC calling 50 hospitals in 17 states. Of the 271 COVID patients in the ICU, 255 were not vaccinated. This as the CDC changing its mask guidance, advising that fully vaccinated people return to wearing masks indoors in areas of high transmission, citing new science that shows even some vaccinated people can transmit the Delta variant. GMA spoke to CDC Director Rochelle Walensky about the new guidance earlier this morning.
We did over this last several days now see new science that demonstrated for those who are vaccinated that they could in fact transmit if they are one of those rare breakthrough infections. So that's new.
And more vaccine mandates could be on the way. President Biden saying they are considering the requirement for all federal employees. Diane?
All right, Eva Pilgrim, thank you. And I want to bring in ABC News medical contributor and infectious disease specialist, Dr. Todd Ellerin, for more on this. Dr. Ellerin, thanks for joining us. I want to start with this guidance from the CDC, now urging even vaccinated Americans in high transmission areas to wear masks. What do you think?
Diane, good morning. I think this does make sense. Remember, yesterday there were over 100,000 new cases in the United States. The majority of those we know have that Delta signature, and only half the U.S. is vaccinated. Now we're hearing from the CDC new science that says, and I've personally seen this, that patients who are fully vaccinated can come in and can have very high amounts of virus, like billions of copies of virus in the back of their nose, despite full vaccination. So with all of those things in place, I think it makes sense to have indoor masking for those of us who live in warm or hot zones in the U.S.
Of the 156 million Americans who are fully vaccinated right now, there have been an estimated 153,000 symptomatic breakthrough cases. So what do those numbers tell you in terms of how the vaccine is doing against COVID in general, but also against the Delta variant?
Right. Well, it says that vaccine breakthroughs are still uncommon. It's true there is some reduced efficacy against infection, especially with this Delta signature. But the clear takeaway is that the full vaccine regimens work against, protect us against the worst outcomes, no matter what variant infects them. That's the key message I want people to understand.
And the CDC is also now advising that everyone in schools wear masks, which is a change from earlier guidance that said vaccinated students and staff could be maskless. So here's the CDC's director explanation for this on Good Morning America. Take a listen.
I'm a parent too, and I want our kids to have a normal school year. So we are continuing to lean in and say the children can and should be back to full-time in-person learning in the fall, as long as those protection measures are in place. So as we head into the school year with more Delta, more disease, more transmission, even among those vaccinated, and the vast majority of people in these schools not yet vaccinated, we felt it was prudent to make sure our kids can have a normal school year and to have them masked to stay safe.
Now, Dr. Ellerin, it didn't take very long to go from kids don't have to wear masks in schools anymore to now they do. So do you think we could see this advice continue to progress and end up back at encouraging remote learning, or are you still confident kids will be back in the classroom this fall?
Obviously, Rochelle and the CDC are taking this very seriously. They're protecting our health, and she wants our kids to be in school. We can't think of masking as a punishment. We know that kids, when they're masking in school, whether they're vaccinated or not, protect against transmissions in the school. So it just makes sense at a time when cases are surging, when most children are unvaccinated at this time. You know, it just makes sense for our kids to mask when they're in school, and that will allow them to stay in school, so we don't have to have the distance learning, because we know how we feel about that.
Now, the CEO of Pfizer is also raising some doubts about the duration of its vaccine's protection against COVID after 6 months, saying a booster shot might be needed. So that 6-month mark is approaching for a lot of Americans. What do you make of that? Should we be worried? Do we need to get on this booster shot thing?
Well, you know, I think that overall, as we're seeing a reduction in the effectiveness of the vaccine against protecting for cases, so we're seeing cases rise, I do think that the booster may be in our future, but I do want to remind everyone that against the worst outcomes and severe illness, these vaccines are working unbelievably well. So, yes, it's time. It may be time in our future that we're going to need a booster. I think that will start with immunocompromised patients. One day it may be, you know, the rest of us, but still remember, you know, half the country is unvaccinated. So I think the most important step is for those people to get their first dose of vaccine, and there'll be plenty of time to talk about boosters later. But I think it's something that may be in our future.
Now, Dr. Elling, with more than half the country now vaccinated, is there any chance we go back to where we were a year ago? And how else do we avoid that?
Diane, you have heard me say this before. The worst is behind us. Why? Because at least half of our country is vaccinated. And again, you know, we hear that the effectiveness of the Pfizer vaccine used to be 95%, and then Israel is saying 64%. And now the latest data from Israel is saying 39%. But remember, the majority of people who are vaccinated are protected against getting hospitalized, getting into that intensive care unit, which we still have some patients up there in my system, and of course against death. So yes, it's true that we're seeing more cases, but remember, these vaccines have been so powerful that we're not going to be back to where we were last winter. That's not going to be happening in my prediction.
All right, Dr. Todd Ellerin, always great to have you. Thank you.
Take care, Diane.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.